The Philippine General Hospital is a tertiary state-owned hospital administered and operated by the University of the Philippines Manila, the University of the Philippines Systems Health Sciences Center. It is the largest government hospital administered by the university, and is designated as the National University Hospital. It is located at Ermita, Manila in the Philippines. It is the biggest hospital in the country with a 1,500-bed capacity. It is a mixed-use hospital with 1,000 beds for indigent patients and 500 beds for private patients, and offers some of the lowest rates for patients and is generally known as the Hospital for Indigent Patients. The PGH, being the largest training hospital in the country, is the laboratory hospital of health science students enrolled in the University of the Philippines. This includes students of medicine, nursing, physical therapy, pharmacy, occupational therapy, dentistry, and speech pathology. There are 14 clinical departments: anesthesiology, internal medicine, surgery, neurosciences, pediatrics, otorhinolaryngology, head and neck surgery, ophthalmology, orthopedics, rehabilitation medicine, psychiatry, radiology, pathology, emergency medicine and obstetrics and gynecology, all of which offer residency and fellowship training. It also offers various training for paramedical specialties such as nursing, physical therapy, occupational therapy, speech pathology, radiation technology, nutrition, hospital dentistry, medical technology and EMT training. On an average year, about 600,000 patients pass through the hospital's halls. Because of this, many organizations help the hospital. Some help the hospital directly, such as the PGH Medical Foundation and the Fr. Barbaro Foundation. Others help patients by financing the cost of medications, operations and therapies. Some of these organizations are based within the university, notably the Mu Sigma Phi fraternity and sorority of the College of Medicine, recognized by UP Manila and the City of Manila as its outstanding organizations, like AAS and PAGSAMA, both multi-college organizations, and the Phi Lambda Delta sorority and Phi Kappa Mu fraternity, also of the University of the Philippines College of Medicine. PGH celebrated its centennial in 2007, 100 years since the U.S. government passed a law establishing it. The hospital has seen the worst of tropical epidemics during its early existence and the worst of the war in the 1940s. It is one of the very few Philippine hospitals that remained open all throughout the war. At present, the hospital has a bed capacity of 1,500 and around 4,000 employees. Architecture. The Philippine General Hospital Administration Building is situated along Taft Avenue in Manila. It was built by architect William E. Parsons in neoclassic style that follows the Daniel Burnham plan for Manila. This plan included Manila Hotel, Army and Navy Club and the Philippine General Hospital. These were executed by his successor. Parsons included, who was a city planner in the Philippines during the early period American colonization in the country. His works was a clear translation of neoclassicism into a new hybrid of colonial tropical architecture. In 1907, the Philippine Commission passed Act No. 1688, which appropriated the sum of P780,000.00 for the construction of the Philippine General Hospital. The cornerstone of the hospital was laid on February 28, 1908. The bids for the construction of the buildings were opened on July 27 and the contract was awarded to the lowest bidder, H. Thurber of the Manila Construction Company. The structural works for the Central Administration Building, a surgical pavilion with 2 operating rooms, a building for dispensary and out clinic, 5 ward pavilions of 60 beds each, a nurse's home, a kitchen, an ambulance stable and morgue were completed on November 30, 1909. In 1910, the Philippine General Hospital opened its door to the public on September 1 with 330 beds and was eventually linked to the University of the Philippines College of Medicine, then the Philippine Medical School. In 1981, First Lady Imelda R. Marcos commissioned Arch. J. Ramos to undertake the master planning of the PGH renovation project.